The so-called Jacinda effect was in full swing when the Labour leader visited Dunedin this afternoon. With so many people turning up to the venue, some had to stay outside while she spoke inside. Announcing policy to party faithful at the Hunter Centre, Ardern told the crowd of several hundred, if elected, the party would begin a Dunedin hospital rebuild in its first term, which she repeated to a media scrum after the meeting.
The funding for the hospital will come from capital expenditure, but there are big differences between what we've announced today and what the government has been talking about. First of all, we're committing to making sure that the hospital is built in the city. We do not believe it should be a PPP. That means that we'll be able to deliver the hospital much earlier than the government is promising.
National's Bill English was announcing conservation policy in Queenstown and defended his party's proposed public-private partnership for the rebuild of Dunedin Hospital.
Because it'll be thoroughly looked at in the context of Dunedin. The reason is because they work. One of the reasons we're getting so much roading done, so many schools, $1 billion of schools just in Christchurch, is because and we're getting them done on time and on budget, in fact sometimes before time and under budget, because the PPP process makes you sort out all the issues, so we've had very few overruns.
When asked by reporters, Ardern said the PPP model hampers progress. The Labour Party is keeping its options open where the hospital could be rebuilt, but has ruled out the Whakaari site.
No, we're keeping an open mind, but we've been very specific about our preference being city centre. Look, even the government has acknowledged that would be their preference. They have more privy to some of the options available, so that demonstrates to us that that is entirely possible.
The Labour leader then went for a walk through Dunedin's public hospital. Daryl Baser, The South Today.